Imagine surviving breast cancer, going through chemotherapy, radiation, maybe years of anti-estrogen therapy, only to face a new challenge: painful intimacy, vaginal dryness, and burning from vaginal atrophy. This is the reality for millions of breast cancer survivors. And here's the truth: relief is possible, even without risking your safety. Hi friends, Dr. Emily here, your OB-GYN and hormone specialist for clear, honest women's health guidance. Welcome back to Vaginal Atrophy 101. Today, in episode 11, we'll focus specifically on breast cancer survivors, how vaginal atrophy affects them, and what safe treatments exist. Why breast cancer survivors are at higher risk. Breast cancer treatments often involve chemotherapy, which can cause premature menopause, aromatase inhibitors, AIs, which drastically lower estrogen, tamoxifen, a selective estrogen receptor modulator, SERM. All of these lower estrogen levels, leading to genitourinary syndrome of menopause, GSM, vaginal dryness and burning, painful sex, dyspareunia, recurrent urinary tract infections, decreased sexual desire. For many women, these symptoms are not just uncomfortable, they severely impact quality of life, intimacy, and mental health. Now we face the dilemma: hormones or no hormones? Here's the difficult part. Estrogen is the most effective treatment for vaginal atrophy, but many breast cancer survivors, especially those with estrogen receptor-positive tumors, are told to avoid it completely. This creates fear, confusion, and suffering. The good news? Evidence-based guidelines now support safe approaches, even for survivors. Let's break it down. For breast cancer survivors, we always start with non-hormonal options: vaginal moisturizers, used regularly, not just before sex; lubricants, water-based or silicone-based during intercourse; hyaluronic acid vaginal inserts, proven to improve hydration and elasticity; vitamin E or vitamin D suppositories. For some women, these reduce irritation; pelvic floor physical therapy, especially when pelvic pain is part of the picture. These are safe, accessible, and should always be tried first. But what if symptoms are still severe? This is where doctors carefully consider other options. Prasterone, intrarosa, a vaginal DHEA insert that locally converts into estrogen and androgens with very low systemic absorption. Ospemifene, Osphena, an oral non-estrogen SERM, approved for painful sex due to vaginal atrophy. It improves vaginal tissue health without acting like estrogen in the breast. These are promising choices, though not always offered to breast cancer survivors. Decision-making must involve the patient, oncologist, and gynecologist.
What is the role of vaginal estrogen? What the evidence says.
Now let's talk about the elephant in the room: low-dose vaginal estrogen. Historically, it was avoided in all breast cancer survivors, but newer research suggests that ultra-low-dose vaginal estrogen may be safe for women on tamoxifen, and possibly even some on aromatase inhibitors, as systemic absorption is minimal. The North American Menopause Society, NAMS, and American College of Obstetricians and Gynecologists, ACOG, state, if non-hormonal options fail and quality of life is severely affected, local vaginal estrogen can be considered with oncology approval. Individualized, shared decision-making is essential. This means survivors are no longer left to just suffer. They have options. In addition to medical treatments, simple lifestyle strategies help. Stay sexually active. Intimacy, vaginal dilators, or pelvic floor exercises improve blood flow. Avoid harsh soaps, perfumed wipes, and douches. Use breathable cotton underwear to reduce irritation. Maintain hydration and a balanced diet for tissue health. It is obvious that survivors need a whole-body approach, not just a prescription. Let's not forget the emotional side. Many survivors feel guilty or ashamed about intimacy struggles, believing they should just be grateful to be alive. But sexuality and comfort are a fundamental part of quality of life. Addressing vaginal atrophy is not vanity. It is healthcare. Every woman deserves to feel whole again. So here's the takeaway. Breast cancer survivors are at higher risk of vaginal atrophy. Non-hormonal options are first line: Prasterone, Ospemifene, and even ultra-low-dose vaginal estrogen may be considered with medical guidance. And most importantly, you are not alone, and you do not need to suffer in silence. In episode 12, we'll dive into vaginal atrophy and sexual health, restoring intimacy and confidence. Stay tuned. Don't forget to like, share, and subscribe. This health series is designed step by step, and following it fully will help you get the complete picture of the treatment. See you in the next episode of Vaginal Atrophy 101 with Dr. Emily.